New tonight, some growing concerns from OHSU as it deals with extreme capacity issues in its emergency department, with patients waiting hours and in some cases days for much needed care. Catherine Cook's in the newsroom with how the hospital is dealing with the strain. Catherine.
Well, David, they're getting creative, moving beds into hallways and other places on campus. Hospital officials tell us there's a number of reasons they're treating more patients than ever, and state health officials believe one of them is a record flu season.
It's hard because patients are uncomfortable. They're sitting in chairs. They're waiting for hours for care.
At a roundtable discussion at OHSU, hospital officials shared concerns over capacity issues, not just here, but all over the state, especially in emergency departments.
The ED is where problems become evident because, again, we're the safety net and we're the backup plan. So we are where people go when they can't access care, and we're also where patients stay when they can't get into a bed.
Dr. Mary Tansky is chair of OHSU's Department of Emergency Medicine. She says here they have 31 emergency beds and 10 in pediatrics. But at any given time, she says there are 80 to 100 patients in overflow areas.
So we've converted an old auditorium into care spaces, basically putting beds around the perimeter, and there's still stadium seating.
OHSU attributes the expanse of ED patients to 3 contributing factors. More people simply need access to medical care. Hospitals are full, and the patients are sicker. State health officials say right now the flu is a big reason for that.
Hospitals across the state are filling up with patients. I mean, even in an average year, the hospital census tends to go way up because of influenza.
Dr. Paul Cieslak with Oregon Health Authority says this is the worst year for flu in the Portland metro area since the state began tracking those numbers 15 years ago. This year, they've had nearly 1,600 hospitalizations for the flu. That's 70 more than the previous record in 2017, with likely more to come.
The positivity rates are still high, so don't think that flu season is over. It's telling us that it's not.
On top of that, Cieslak says only about 29% of Oregonians got the flu vaccine, which is recommended for everyone 6 months and older. He's especially concerned for seniors, as more than half of those hospitalized for flu are over 65. Finally, health officials say this flu season could be with us until June.
You know, if you haven't been vaccinated already, it's not too late.
During OHSU's roundtable, hospital officials gave an update on efforts to increase capacity. A big one is construction of a new inpatient addition. It'll add 128 beds and open next year. David.
Thanks, Catherine. Appreciate you shining a light on a key important issue.